Mass News is your vaccine authority, and as more people become eligible to receive their shot, many viewers have been reaching out to us with questions about whether already having the coronavirus would impact or delay their ability to go and get the vaccine.
And we're getting answers for you this morning. We spoke with local doctors to find out.
I'm calling because both my husband and I had COVID, and I heard around the block, so to speak, that you have to wait 90 days before you can get your vaccine.
A Western Mass News viewer named Dorothy calling our Vaccine Authority hotline, wondering how long she should wait to get the COVID-19 vaccine after having the virus. Chief Medical Officer at Mercy Medical Center, Dr. Robert Roos, says the guidance has changed.
If somebody's 14 days after having the virus and they're feeling back to their normal self, we recommend that they get the vaccine anyway, as it will likely create improved immune protection for a longer period of time.
The original advice from the Centers for Disease Control and Prevention was to wait 90 days after recovering from COVID. Dr. Roos tells Western Mass News that guidance was tied to uncertainty about vaccine supply at the time.
We have very little vaccine, and we wanted to get it into arms of people that were the most vulnerable. And people that just had COVID likely have some natural immunity and so are not that vulnerable to getting the virus again that fast.
Speaking of immunity, a Western Mass News viewer named Kenny called our hotline with questions.
I was tested positive the first week in January. How long will my antibodies last? And am I immune for how long?
Local doctors we spoke with say at this time, no one knows exactly how long immunity lasts. So even if you had the virus, you still need to get vaccinated.
We do know that there's a period of natural immunity. So if you were exposed to the virus, you've likely created antibodies and you're going to be protected for a period of time. We don't know exactly how long.
What we do know about COVID is that reinfections are possible. It does appear that immunity after the initial infection doesn't last indefinitely.
Infectious disease doctor at Bay State Medical Center, Dr. Megan Gallagher, says the CDC strongly recommends people who had the virus get vaccinated, especially people who were infected early on. Another viewer called our hotline asking if people should get tested prior to getting the vaccine. Doctors say generally testing prior to getting the shot is not required, but before scheduling an appointment to get the vaccine and right before getting the shot, you will be asked if you've been exposed to the virus.
If the answer to that is no, then you really don't need to get a test. You can proceed with the vaccine.
But what if you didn't know you had the virus and were vaccinated? Dr. Roos says not to worry. Receiving
the vaccine, even if you are infected, is safe. It's not going to, induce any particular concerns. We don't want to confuse the clinical picture for somebody who is now sick and then also receives a dose of the vaccine.
Obviously, we don't want somebody coming to a vaccine center and giving COVID to the vaccinators or to the other people standing in line.
For Western Mass News, I'm Jordan McCool.